It's remarkable. You know, this was a brainchild of Al Kyoto, our undergraduate director, and to have 90 students sign up for an event like this is amazing.
Up to now, we've been using it in the clerkship, and the AutoSims are available on the clinic floor or in the academies. This year we've decided to do the AutoSim for our Triple MD week. On the floor, when we use it in the clinic, we usually will sit down with the 2 or 3 clerks and go through a majority of the common diseases, otologic diseases that they should know about. Because it's available on the floors, they can easily review that with their academy site director or faculty member, and you can have multiple students working on that.
We think of this as a real breakthrough in terms of medical education, because now we have the ability to actually show students what we're looking at, and they can identify the important pathology. I love that they've got both common and uncommon pathology, and even some quite rare pathology. And so I'm sure that some of the students going through this program will in future years go, aha, I recognize that because I saw it using the AutoSim. Originally it was thought that it was only going to be a one-on-one session, which it still can do, but the ability to teach multiple people at the same time, I think, is just such a big advantage. A lot of times they're afraid to say, I don't see it, or they believe they're seeing something and they just put it off as the fluid level, but now they actually know what it is. They know what the instructor's looking at. And I think many of them are seeing these pathologies for the first time.
It was amazing. In the short period that we have during our training, you really don't see the range of pathologies that you would see in a clinic. It was kind of nice to be able to have that interaction with the speaker, to be able to say to him, clarify certain aspects of the image.
It was really cool and really helpful. Like, I've looked in ears before, and you never know what you're actually looking at. It's good that they could circle exactly what they were talking about. The clarity was a big thing, because you could actually pinpoint all the little tiny differences. I think it should be used earlier on in training.
Always good to practice when you're not pulling it too hard and hurting someone. You can actually look through the otoscope and see what they're talking about. At this point, it's been a little bit difficult. You basically just have a tutor show you the proper techniques, and then it's a little bit of trial and error with your colleagues on examining each other's ears. This was a great 1-hour event where you get a lot of information and a lot of exposure to something which might have taken a little bit longer in our training to acquire.
It was actually amazing. I really thought it was a great experience for students to learn about examining the ear. I really enjoyed how we could actually look into an ear without anyone moving around. It's much more realistic in the sense that you can actually look right into the ear and you feel like you're actually in a clinical setting. I would recommend it to not only all medical students in my class, but medical students across the country and other countries as well.
I think that in this sort of new era of medical education, we are looking for new ways of teaching our medical students, our trainees, to do hands-on sort of teaching, but avoid that necessity of having direct patient contact. I think things like the AutoSim provide that medium on a very realistic simulator. It's really a great tool. If I think back to sort of my medical training, both as a medical student and as a resident, I think that if I had hands-on experience looking down an ear, looking at different ear pathologies earlier on in my training, I think, again, you're just further along.
I think it's a vital tool for the medical student to be able to bring it down to the level of a patient, to simulate that process is, I think, very important. I've been involved with medical education for a number of years, and I was just delighted to see what Dr. Forte and Dr. Campisi were able to invent. I'm very glad that we have this valuable resource in our department.
I wish we could put the AutoSim in every medical education center in the world.